ओम धम धन्वंतरे नमः। रागादिरोगान् सततान् शक्तान् अशेषकायान् प्रसुतान् शेषान् औत्सुक्यमोहार्जितान् जघान यो पूर्ववैद्याय नमोस्तु तस्मै। Let me share. So today's topic is cardiac arrhythmias, the ECG study. So cardiac arrhythmias mainly of two types. One, due to disorders of impulse production. Number two, due to disorders of impulse conduction. So impulse production disorders effects are sinus sinus tachycardia, sinus bradycardia, supraventricular atrial tachycardia, atrial flutter, atrial fibrillation, ectopic beats, escape beats. These are the main types. And in impulse conduction, first degree AV block, second degree AV block, Wenger type 1, type 2, and complete heart block or third degree AV block. And also bundle branch block, left bundle branch block and right bundle branch block. So this is an ECG of a patient with sinus bradycardia. Sinus mechanism present. If it is present, then there will be normal P wave. Normal QRS complex follows the normal P wave, and PR interval is constant. Then it is taken as sinus mechanism. And if bradycardia is there along with that, it is known as sinus bradycardia. If the ventricular rate, heart rate is less than 60, it is known as bradycardia. So here RR interval is 30 millimeter. So the ventricular rate is 50 per minute. Less than 60, that is known as bradycardia. Here it is sinus bradycardia. So sinus bradycardia is seen in conditions like athletes, hypothyroidism cases, and drugs like digoxin, and in conditions with increased intracranial pressure. This is another ECG of a patient with sinus bradycardia. You see, sinus mechanism is there in each bit, isn't it? It is normal P wave, and P wave is followed by normal chaos complex, and PR interval is constant. And heart rate is also low, less than 60, isn't it? So near about 10, 20, 30, 30, 30, 38 or 39, 39 millimeter error interval. So if nearing to 40, 40 is 1500 by 40 means roughly it is about 40, 38 or 40 beats per minute. That is bradycardia, isn't it? Sinus bradycardia. This is also a patient of sinus bradycardia. You can see normal P wave in each beat and normal chaos complex following the P wave. PR interval is constant. And heart rate is also, it is less than 60, isn't it? 30, 40, 40 millimeter. RR interval is 40 millimeter and is about 1500 by 40, isn't it? 38 or something like that, 40 beats per minute. That is a case of bradycardia, sinus bradycardia. There is another patient with sinus bradycardia. You can see sinus rhythm. It is normal P wave, normal chaos complex follows the P wave, and PR interval is constant. And RR interval is 32, 32 or 33. 1500 by 33 is less than 50, isn't it? That is a case of bradycardia, sinus bradycardia. Here is a sinus tachycardia. If the heart rate is more than 100 and sinus mechanism is there, it is known as sinus tachycardia. And sinus tachycardia is seen in conditions like anxiety, pain, emotion, and after exercise. And also in hyperthyroidism, hypovolemic shock, and fever, and drugs like epinephrine, dopamine, and tricyclic antidepressants. Tricyclic antidepressants like uh, uh, they are given in depression, mental depression. That's it. So they are also called tachycardia, sinus tachycardia. So you see, the sinus normal sinus mechanism is there. That is normal P wave, and P wave followed by normal chaos complex, and PR interval is constant. But R interval you see it is 10 mm. That is the ventricular rate is 150 per minute. It is more than 100 in the case of sinus tachycardia. Here you see 15, isn't it? R interval 15. So ventricular rate is 100 per minute. In the case of sinus tachycardia. So you see R interval is 10. So 1500 by 10 equal to 150. So ventricular rate is 50 per minute. That is tachycardia, sinus tachycardia. The mechanism is sinus. Here also sinus tachycardia 10 mm. R interval is 10 mm. So 1500 by 10 mm is 10 is equal to 150, more than 100 per minute. That is the case of sinus tachycardia. The mechanism is the sinus. Normal period, normal PR complex, QRS complex, and PR interval is constant. This is a case of sinus arrhythmia. Noted. During inspiration, the heart rate is increased. During expiration, heart rate is decreased. Especially in children also it is same. So it is a case of sinus arrhythmia. It is a normal phenomenon. Okay. There you see sinus dysrhythmia. You see, alternatively, there will be the heart rate will be increasing and decreasing regularly due to in patients of inspiration and expiration. That is sinus dysrhythmia. This is also case of sinus arrhythmia. You see, during inspiration, heart rate is increased, R interval is small. During expiration, heart rate is decreased, R interval is large. There also sinus arrhythmia. Heart rate varies. During inspiration, heart rate increases. During expiration, heart rate decreases. The normal phenomenon. This is a case of atrial flutter. The sawtooth-like waves, they are the characteristic finding of flutter, atrial flutter. You can see the P wave width is 5 mm. That's it. 5 mm. Sorry. Yeah. The P wave is 5 mm. And PRS complex, it is occurring late, isn't it? 3:1. So, atrioventricular ratio is the ratio between atrial waves and ventricular waves is 3:1. That is 3:1 block. Okay. So, atrial flutter waves. You see sawtooth like waves, that is characteristic of flutter waves. Heart rate is 300. Between 300 and 400, 250 400, it is a flutter. And 400 to 600 atrial rate is there. It is known as fibrillation. This is another patient of atrial flutter. You see the wave width is 5 mm and atrial rate is 300 per minute. The case of flutter. So sawtooth like appearance of the P wave. In another case of atrial flutter, you can see there is every 4 P wave there is one QRS complex, isn't it? There you see flutter. See the width of the P wave is 5 mm. The atrial rate is 300 per minute. And sawtooth like P waves are the characteristic of atrial flutter. There you see atrial fibrillation, atrial flutter, multifocal atrial tachycardia. In atrial fibrillation, heart rate is more than 300. Between 300, more than 400. 400 to 600 is known as atrial fibrillation. The fibrillary waves, that is the wavy pattern of the baseline. So the ventricular rate is more than 400 per minute. In atrial flutter, sawtooth-like P wave is there, and the atrial rate is more than 300. In multifocal tachycardia, there will be increase in heart rate, but they are irregular. You see atrial fibrillation and atrial flutter. In an atrial fibrillation, fibrillatory waves are seen in the ECG. The wavy pattern of the baseline, that is a of atrial fibrillation. The ventricular atrial rate is between 400 to 600 per minute. Below, you can see atrial flutter, sawtooth-like pattern of P waves, and atrial rate is 300 per minute. So atrial fibrillation and atrial flutter. In atrial fibrillation, the big capital F waves, that is the wavy pattern of baseline. The atrial rate would be more than 400, between 400 and 600 per minute. In atrial flutter, there is sawtooth-like P waves, and atrial rate will be more than 300, 300 to 400. The atrial fibrillation, atrial flutter, and multifocal atrial tachycardia. Ventricular tachycardia, you can see no P waves are there. Only QRS complex, wide and bizarre QRS complex is there, and ventricular rate is near about 300. Isn't it? This is ventricular tachycardia. No P wave is there. Normal P wave. This is also ventricular tachycardia. You can see. Isn't it? Wide and bizarre QRS complex. P wave is absent of them. Here, non-sustained ventricular tachycardia. You see, after 3 normal beats, there are wide and bizarre QRS complex. That is the ventricular beats. So, ventricular tachycardia. So, that is same. Here also. So here, you see ventricular fibrillation. No periods or normal periods are same. Only wide and bizarre QRS complex is same. And ventricular rate is more than 300. More than 300. Ventricular tachycardia. Ventricular fibrillation. Sorry. Ventricular fibrillation is severe condition. This is also case of ventricular fibrillation. See where the wide and bizarre QRS complex. Here is almost absent and heart rate is very increased. This is a case of ventricular tachycardia. This is also a case of ventricular tachycardia. You can see the tracing. Ventricular fibrillation. Ventricular fibrillation. Ventricular tachycardia. Wide and bizarre QRS complex. Ventricular origin. Wide and bizarre QRS complex. Ventricular origin. There is a bigeminy. Every second beat is wide and bizarre and of particular origin. This is ventricular bigeminy. Also same. Every second beat is wide and bizarre. Ventricular mixture beat. So it is a ventricular bigeminy. The ventricular bigeminy. Every second beat is extra beat from VPB, ventricles. It is known as ventricular bigeminy. This is also a case of ventricular bigeminy. Every second beat is a VPB. So it is ventricular bigeminy. The trigeminy. After 2 normal waves, 1 ectobeat is there, premature beat is there, ventricular premature beat. So after normal beats, 2 normal beats, 1 ventricular premature beat. It's a trigeminy. It's also trigeminy. It's a normal corresponds 2 normal characters, and then third one is a ventricular premature beat. Is trigeminy. This is also this. You see, after 3 normal beats, 1 ventricular premature beat is same. Wide and bizarre premature beat. The beat which has occurred earlier than the normal beat, and it follows complete compensatory pause. is also ventricular mature beat. The heteroregulation, heteroprota, multifocal aorta. See how it looks like. So today we have discussed the cardiac arrhythmias and the ECG study. Thank you for patient hearing. Thank you.